Dreams and Mourning by Alexandra Golfus. Task model of mourning. To understand how dreams are related to grief counseling, it is important to first understand the task of mourning model. So basically, the task of mourning model provides a framework of 4 tasks that help counselors and honestly clients alike to kind of assess grief and understand how people journey through grief as well. So, the 4 tasks of mourning include task 1, which is accepting the reality of the loss. So, basically, although you may intellectually know that the person or your loved one has passed away, you may experience a sense of disbelief or denial. Task 2 involves processing the pain of grief. So, basically, grief is experienced emotionally, cognitively, physically, and spiritually. So you have to process your pain in all of those different, I guess I'll call them contexts. Task 3 involves adjusting to the world without the deceased. So there are external adjustments. Those include taking on responsibilities and learning new skills. So let's say, the client that you have is an adolescent and they lost a parent figure that would normally pack their lunches or something, right? Dad works, mom would pack their lunch. So now the whole family is kind of adjusting to a world without the deceased. And then you also have internal adjustments that are made as you adapt to your new identity. So kind of figuring out who you are in light of a world now where that person is no longer there, right? Because we all take on roles within our families. So, if I was a daughter to my mother, and that was kind of my main identity in the family. Now, what role do I take on? And then lastly, spiritual adjustments involve how your view of the world has changed. Obviously, encountering a loss can change your spiritual views pretty dramatically. I know I had kind of experienced that myself personally with my mother's passing in March of 2021. Was already kind of dabbling into Christianity, but whenever she passed away, I really dug deep into the Bible, and that's something positive that came out of it. I definitely got close to God and formed a solid spiritual foundation. But, anyways, task 4 involves finding a way to remember the deceased while embarking on the rest of one's journey through life. So, this involves carrying out the day to day functioning while finding healthy ways to remember your loved ones. So, when clients encounter issues with any of these 4 mourning tasks, it can often lead to complicated grief reactions. The task of mourning model provides an approach and empowers clients through their grief so that they can move forward in their life while still remembering their loved one. Complicated mourning. So, we kind of have to understand complicated mourning to understand dreams and grief therapy a little bit better. So, complicated mourning is a term used to describe when there is something that is impeding the mourning process and not allowing an individual to move forward towards good adaptation to their loss. It's generally characterized by prolonged and intense grief that can significantly impair a person's work, health, and social functioning. The mourning task can help provide both therapists and patients a clue as to what is going on and provide a framework for effective interventions. So, in other words, basically, by having a task model, counselors and clients can kind of identify where they are through their grief progression and what issues they may be encountering that are stopping them from learning to cope in a healthy way, so to speak. Meaning that, they don't have all those negative symptoms, I'll call it. So, although complicated grief is not listed as a clinical disorder in the DSM-5, the DSM-5 does provide diagnostic standards for chronic complicated bereavement disorder. Chronic complicated bereavement disorder entails long-lasting symptoms that do not get better with time, with a severity of symptoms that interfere with day-to-day functioning, including deep emotional suffering, empty and gloomy sensations, desire to meet the deceased again, obsession with the departed or the manner of their passing, having trouble remembering nice moments with the deceased, avoiding any references to the deceased, a weaker feeling of self, separation and seclusion from surviving relatives and friends, and an unwillingness to pursue personal goals or interests. How dreams reflect the task of mourning. In grief counseling, dreams can offer valuable insights into the mourner's emotional state and their progress through the task of mourning. Here's how dreams can reflect these tasks and what new perspectives they can offer. Getting a little closer because it's a lot of information. Task 1. Acceptance of the reality of the loss. Dreams may initially involve themes of denial or disbelief, where the deceased appears alive or the loss is not acknowledged. As the individual progresses in mourning, dreams may shift to accepting the reality of the loss, where the deceased may appear less frequently or in a more symbolic manner. Task 2. Processing the pain of grief. Dreams can serve as a safe space to express and process intense emotions associated with grief. They may manifest as vivid and emotionally charged scenarios, allowing the mourner to confront and work through their pain. Task 3. Adjusting to a world without the deceased. Dreams may portray attempts to reestablish connection with the deceased or adjust to life without them. These dreams might involve shared activities or symbolic representation of the mourner's evolving relationship with the deceased. Task 4. Finding a way to remember the deceased while embarking on the rest of one's journey through life. As the mourner progresses through grief, dreams may reflect a sense of resolution and if I can say this word, I always have a hard time with it. Reconciliation. Y'all know the word. The deceased may appear less frequently, signaling the mourner's growing ability to emotionally move on and kind of progress. The role of dreams in the grieving process in grief counseling. Understanding the symbolic language of dreams can help both the counselor and mourning clients make sense of complex feelings and experiences associated with grief. Dreams of bereaved individuals often parallel the mourning process and reflect the particular task of mourning with which a grieving client is struggling with. So, in other words, analyzing dreams of grieving clients can assist counselors in assessing what task of mourning a client may be stuck on, along with why they might be stuck on that task. From this understanding, dreams while grieving serve to either redefine the relationship with the deceased, so that's relating to task 1, integrate troubling effects such as guilt and anger related to task 2, help the mourner struggle with many problems to be solved adjusting to the world without the deceased, task 3, and lastly, show the mourner how to go on without the deceased, or task 4. So from this perspective, dreams offer a window into grieving's subconscious mind, providing insights that may not be readily accessible through conscious reflection. Ultimately, dreams can serve as a tool for exploring unresolved emotion, conflicts, and attachments related to the loss, helping to facilitate the therapeutic process. How to incorporate dreams into grief counseling. An example. Example. A woman named Susan struggles with guilt and unresolved emotions following the death of her mother. To incorporate dreams into grief counseling with Susan, counselors can do 1. Dream exploration. Begin by inviting Susan to share any dreams she has had related to her mother's death. Encourage her to describe the content, emotions, and any recurring themes or symbols present in the dream. 2. Symbolic interpretation. Work with Susan to interpret the symbols present in her dreams. Explore how these symbols may reflect her inner conflicts, unresolved emotions, or unmet needs related to her mother's death. 3. Emotional processing. Use the dreams as a catalyst for emotional exploration and processing. Help Susan identify and express the underlying feelings and concerns surfaced in her dreams, such as guilt, sadness, or longing. And 4. Integration and meaning. Assist Susan in integrating insights from her dreams into her grieving process. Encourage her to reflect on the significance of her dreams in relation to her relationship with her mother and her journeying through grief. By incorporating dreams into the task model of mourning and the counseling process, counselors can provide Susan with a holistic approach to grieving that honors her emotional experiences and facilitates her healing and growth. So that was kind of, a light example to get us thinking about it. So now we're actually going to go ahead and dive into a full-on case study. The case study was provided by the textbook, Warden's textbook, 2018. So Dreams and Grief Counseling Case Study. In this case study, the counselor can use the client's dreams to assess which task of mourning the client is having issues with. Brief case summary. A 38-year-old single woman has been experiencing sleep difficulties over the past 3 months since her stepfather died suddenly of a heart attack. Case details. A 38-year-old single woman lost her alcoholic stepdad 3 months ago suddenly to a heart attack. He had come into the client's life when she was 3 years old, and over the years he had been physically and sexually abusive to her until she left home at the age of 17. She reports being unhappy to hear of his death and is glad that he is out of her life and that she can only remember negative things about her stepdad. However, since his death, she has had several dreams of him with his arms outstretched toward her. She reports being unsure of the meaning behind the dreams, but that she wakes up upset and unable to go back to sleep. Furthermore, she reports that her disturbed sleep is beginning to negatively affect her work performance, leading her to seek counseling. So, her symptoms are not only present, but they're also impeding her life, kind of signifying that we have some grief complications going on in this case. So, to incorporate this client's dreams into her grief counseling, the counselor should explore her symptoms in light of her recent loss and see if there's any grief work to be done. The counselor should help her identify and facilitate it if so. So, the client's dreams in this case study indicate that she's having trouble with task 2, in integrating the trouble affects of probably her anger or maybe some other lingering feelings that we'd have to dive a bit more into to fully grasp and then start a treatment. But recognizing that she's having issues with task 2 gives us, an assessment of where she is and kind of a sense of what direction to go then as far as treatment. I know with my own personal experience with losing my mother, I was having a very, very intense nightmare a handful of times. It happened where my mother, I could just see her, right? All I could see, I couldn't see, like I wasn't looking down eagle eye. I could just see my mom, and I would see that she was stabbed and like bleeding, and I'd be like, oh no. So the first 1 or 2 times that happened, I woke up sweating, panicked, and then I think like the third or fourth dream is when I would like see her being stabbed, and then I would actually look further down and see my hand holding the knife. I did go through this actually in therapy, and it was related to my attachment with my mother. Now looking back through my own personal experience with grief therapy and kind of being reminded of it through this class. So yeah, dreams and grief counseling can definitely be a great asset, tool, I guess you can call it, to assessing where a person is in their grief journey. So these are our lovely references. Definitely check them out if you want to get some more information on grief therapy and dreams.